All right, there you see our guest, Dr. Craig Walker, the famous Dr. Craig Walker. I always tease him about it, but he sure has earned a big name across the whole entire world. And next to him is Frank Lagarde Jr., who's a PAD patient. So, Dr. Walker, PAD Awareness Month. It's got to be a big month for getting the awareness out, right?
It is. You know, Mark, this is a huge problem. The estimates of how many people are affected by peripheral arterial disease are really old and are wrong. More recent studies would suggest that as many as 20 million people in America have peripheral arterial disease. It's the leading cause of limb loss. It hurts people in terms of ability to exercise and live normal daily existence. But something that is still not widely recognized, and something that we've been speaking a lot about, it is often the only harbinger of other diseases. It tells you other things are going on. Most people with peripheral arterial disease don't just have blocked leg arteries. They often have blocked heart arteries. They often have blocked carotid arteries. And so these patients are at increased risk of dying. And there are many patients in whom the only clue that they had disease was that I simply couldn't feel a pulse in the foot. And then when we studied them, we found life-threatening disease in other parts of the body. And you see, it's not uncommon. These patients feel nothing because they can't walk far or fast enough to cause chest pain. And so it's not such an uncommon problem with peripheral arterial disease for people to have no clue anything else is going on. And then finally, most people with peripheral arterial disease don't think they have leg blockages. They think they've got arthritis or other problems. The key to this disease is if when you walk, you get pain in a muscle, it's probably inadequate blood supply and therefore peripheral arterial disease.
And you brought Frank Lagarde Jr. here. We thank you for coming. We appreciate it, first of all.
I appreciate it.
You got stuck in traffic on the way here,
yes,
didn't you?
Yes, I did.
Okay, so can I ask you, I mean, the prior on your age, how old were you when you found out that, or when you started feeling like you may have a problem and you got to go see the doctor?
I was 58 years old, and I can tell you the day I kind of knew I had a problem, I didn't know what it was, but I was working at my little farm in Mississippi, and I was putting up fence, and I thought I had pulled a muscle. I was picking up a post. It felt like a pulled muscle behind my knee. Right. I have an orthopedic surgeon I go to, and I went to him, and he said, no, it's he could tell right off the bat, it's not anything with your knee, it's circulation.
Okay.
So
and
that's how
you
I
didn't
got
have
started.
any, I mean, did you have any predetermining signs that you thought you might be having problems, or this was the first that
This was the first indication that I knew I had a problem. Within 3 or 4 weeks, though, I started having severe pain in behind my calf, like a Charlie horse,
right,
after walking 30 or 40 yards. At the time, we get paid for Disney World in February, so my first surgery was after the Disney World by my cardiovascular surgeon in Metairie. Had a great result, full blood flow back to my foot. I contracted the staph infection in the hospital. I ended up staying 7 months in the hospital.
7 months?
7 months, except for about 30 days. I get out and go right back in.
Wow.
Luckily, my office is only about 3 blocks from the hospital, so my secretaries came and brought me work every day when I was awake. During that time, I had 7 procedures, though. And what they did was just try and save my leg. We took the graft out 7 months after I had the graft, October of 2008, the day before, or actually a week before my daughter got married. And I walked her down the aisle without a wheelchair or anything, but I still had a severe pain. I was in excruciating pain.
And you're an attorney, so you missed a lot of work.
I'm an attorney, but yes, I miss work. I also have a full-time live oak tree nursery in Poplarville, Mississippi.
Oh, right.
That I just had neglected for that time, and I also have a small cattle farm. So the neighbors all pitched in and took care of that and told me don't worry about it. I had great neighbors up in Mississippi. And
Did you say 58 or 59? couldn't remember.
I was 58 when I had the first inkling that I had some problem with my leg.
Okay. Now, is that a typical age, Dr. Walker, where you see, I remember you saying, for HIPAA laws, we won't say names, but you've treated them as early as 21.
Even younger than that I've treated.
Wow.
But today, I was just saying, I had a patient today who came in who at age 21 had both legs bypassed at the Mayo Clinic, and who today presented with ulcers on one leg and rest pain and marked discoloration of the leg, who's in trouble. Now, in Frank's case, he had a bypass. He had a popliteal aneurysm, and they bypassed it appropriately.
Now, what is that, a popliteal?
It's an aneurysm or a weak spot in an artery behind the knee. And commonly those shut down right away. In 50s in a man is a common time for that to present. So they did a little bypass around that. The problem is the graft got infected. And so when that graft gets infected, you actually have to remove the graft because you can't ever make the infection go away otherwise. So then when they removed that with the scar tissues and everything going down, he had no real circulation getting to his foot. And of course then the leg went from being bad to real bad, and that was the difference, and that's where we were.
Now, when did y'all connect? When did you and Dr. Walker connect?
My wound care doctor, who took care of the infection, and my cardiovascular doctor, one wanted me to go to Mayo, one wanted me to come to Dr. Walker. My records were sent to Mayo. Turns out that the surgeon who got my records, knew Dr. Walker. So he told
Everybody knows
he
Dr.
told my
Walker.
wound care doc, he said, don't come to Scottsdale, Arizona. Go right to Dr. Walker in your backyard. So that's how he and I got together. In, I want to say, November of 2010, I had my first procedure before Christmas. He told me come back after Christmas to check to see how we had done. And his brother did the test on my leg, and I think I had about an 80% circulation. I'm ecstatic because I went from almost zero. The pain was gone. I could sleep all night without a knife in my foot. I was starting to walk much better. I still was very weak because where they took out the dead muscle in my right leg. So I came back to see him in January of 2011. He said, we had great success, but, no, he said, I'm not satisfied. He said, I want you to come back, and we're going to go in again and just miss some spots that I think I could have gotten, but I can get them now for sure. I'm thinking we'll come back after Mardi Gras. This is a Tuesday that I'm seeing. He said, I'll see you 6 o'clock Thursday, 2 days down the road. Wow. So I had to scramble. I came right back, and I was out that afternoon, and I have about 97% blood flow. The pain is absolutely gone.
How did you feel? When did you feel that something was accomplished? Was it right after?
Within a day. Okay. Within a day, after the anesthesia wore off. Now, the first time Dr. Walker kept me in the hospital, I was supposed to stay 1 day. I stayed 4 days, and he can explain why. I think I was such in bad shape with my leg. It took him longer than he thought. And he can explain why it took so long.
Because they got people watching Dr. Walker that might be experiencing the same kind of symptoms, and they're not aware of it. Was he in danger of losing his leg?
Oh yeah, he was in real jeopardy of losing his leg, and that's why his doctor had wanted him sent here. Really, just even a tight-fitting shoe, creating a little tiny blister on the foot could have resulted in Frank losing his leg at that point. The flow was that bad. Now, once we opened it up, the part of why he was in a little bit longer was because I wanted to make sure that while we were down there stirring things up in an area where he'd previously had an infected graft, that we had him on a little antibiotic and things, just basically to protect him. And part of the care of this is follow-up. After we did the procedure, we saw him back. We started off with an area of total blockage about this long, from above the knee to well below the knee. After that, we didn't have total blockage, but we had one little tiny area that had about an 80% blockage. Well, it's very important to fix that and not wait until that becomes 100% and the whole thing clots off again.
Now, you said that big to start. Is that a what's considered a big
a long blockage?
Long blockage.
Longest blockage I ever worked on was in a former NBA basketball player, and it was more than a yard of total blockage. More than a yard of artery was.
How long does
totally
it
blocked.
take you to get through that?
In this case, we were lucky, and we got through pretty easily, and we got really a pretty fantastic outcome. But on that man, because I couldn't reach, he'd had multiple surgical procedures, and I couldn't stick the legs, so I actually had to come from under the arm. No catheter would reach. So then I actually stuck the foot and came backwards from the foot and was able to get it open.
With this new technology, if we go back 20 years to Frank, and he has what he had and he starts off, right now, did he lose his leg 20 years ago?
For sure. We didn't have the technology. 20 years ago, we were just starting to get hydrophilic wires, and we had balloons, and that was it. And that may not have been enough horsepower or enough equipment to really deal with the kind of problem that Frank had presented with. You know, now we've got tools that remove plaque. Now we have clot-busting drugs. Now we have longer balloons that work better and specialized balloons. Now we have stents, and all of these things have had major impact in the.
But don't you make recommendations to boards and manufacturers? Don't they come to y'all and y'all help make the new devices? Because after all, who better to give them advice than the people working on it?
We do spend a lot of time with industry. It's an important part of what we do. Last week I was with industry in Minneapolis for 3 days. I actually met with several companies about concepts of new things that might help in the periphery. Better tools, for instance, to catch any of the debris that may come when we do a procedure like this. Right now we don't have dedicated tools for catching the debris. In leg procedures, we have it for carotids, and this is very different. A carotid blockage is never total when we work on it, and it's short. A leg blockage is often this long, and so you can imagine, and usually is total. And so there's a much greater chance for gunk coming out of this, a long blockage here, than there is coming out of this. And so we need bigger baskets to catch the material.
With all that sophisticated equipment, they still call it gunk, huh?
No, I do. Other people would call it different things, but I think it's important. You know, it's many different things. It's a breakup of the plaque, it's old clot, it's all these other things, and I call that in South Louisiana jargon junk. And that can go downstream, and it can affect blood flow further down, and so we want to avoid that. We actually founded one company that's actually meant to deliver drugs, just like the drugs that we use on medicated stents to block the likelihood of a blockage coming back. We can actually do that using ultrasound technique. And so certainly there's a lot of research, a lot of innovation going on in this area, and I really think in the not so distant future that we're going to be able to open up most every blockage. I think it's going to indeed be incredibly rare that we cannot restore blood supply.
Frank, you got to feel pretty lucky. I mean, he said 20 years ago, you lose your leg. You ever sit down there thinking at home that, thank God I had this problem 20 years later?
I think I'm blessed also. I think God put myself and Dr. Walker together. And I tell a story. I have a client who, he will tell you he's a heathen. And when I said, Mike, his name's Mike, I need some prayers. He says, oh, he's Cajun. He said, Mr. Frank, you don't want me praying. He says, God, you don't talk to me. I've done some bad things. I said, no, Mike. To the contrary, when you pray, the old man's going to hear you. He's going to say, who is this? What's this guy want? Right. And this guy came to see me in the hospital all the time. He was always there for me. We're still best friends. But, you know, one thing I want to follow up on, Dr. Walker mentioned the wound on your foot. The second sign I had, I was in my kitchen at my house with my 4-year-old grandson that Dr. Walker's met, and he starts saying, you know, Mama, there's blood all over the kitchen. And I looked, and there was blood spots, and it was coming from the ball of my foot. Wow. So the first thing I did, I had been to the cardiovascular surgeon, and he told me, go see the wound care center at the hospital. And they took care of that and stopped it. The third sign I had was a black toenail, which shows no circulation. And then the severe Charlie horses in my calf. And the next sign was like a knife sticking in my ball of my foot. Those are all sure signs that cannot be ignored, that we must educate people to. There are many things that can be done, and the earlier is intervention, the better for the patient.
Okay.
Martin, I think there are many points very worth mentioning, though, as you look at amputation, because if we look at major amputations in the United States in 2011, there are about 200,000 major amputations. That would be above the knee or below the knee. That's not counting
200,000?
200,000 a year. That's not counting getting a toe taken off or getting the front of a foot taken off or part of the heel. That's a major amputation. Now, a lot of people think, well, gee whiz, once you've amputated, all pain is gone. Wrong. You keep hurting forever because you have phantom pain. Those people, even though their leg is gone, still feel their toes.
So
and
if
often,
they itch or have pain, they can't do anything about it.
right, because there's nothing to touch. In addition to that, 1/2 of all people who have a below-the-knee amputation will ever get a prosthesis and walk again. Above the knee, only 1/4. 1/3 of patients who have a major amputation go straight from surgery to a nursing home and never leave again. And finally, it's not only expensive and morbid, because we know it's bad to lose the leg and you have all these complications, but there's a high mortality rate. And above the knee amputation at the best centers in America, not the average center, the best, carries between an 8 and a 12% death rate in 30 days. Below the knee, 5 to 8% are dead within 30 days. If you take the group and you put them together, within 2 years, half are dead. So amputation's a bad thing. If we can avoid amputation, it's something to really avoid. A lot of
Did
people
you say
think
2 years down the road, half of them that
half
have?
of them are dead. And so it's not something to be taken lightly. Many people feel, well, gee whiz, my leg hurts, it's better, I'm just going to get it off, that's the end of this deal. That's really an error. That's not the way one should think. Now, there's some cases you have no choice. You can't get blood supply, the leg is open, it's infected, and if you don't remove it, you will seed the blood with germs and you know, it will kill you. But I would suggest to you that's by far and away the exception, not the rule. The vast majority of people being amputated in today's world could have their limbs saved with appropriate technique.
Let's do this. We'll take a break. When we come back, let's go over all the warning signs again, let people
Okay.
know, and what they can do if they have those symptoms. We'll take a break. We'll be right back. Don't go away.